This video is brought to you by SMARTICON, your partner in statistical analysis and research methodology. Machine learning models are increasingly used to guide decisions in healthcare, business, and public policy. But most machine learning algorithms focus on prediction and statistical associations, not on causal relationships. So an important question arises: can we rely on machine learning to make decisions if it does not identify causality? Machine learning is powerful because it can detect complex patterns in large datasets. These models can identify combinations of variables that strongly predict outcomes, even when relationships are non-linear or highly complex. In many situations, the goal of decision-making is simply to predict what is likely to happen, rather than to understand why it happens. For example, predicting which patients are at high risk of hospital readmission, which transactions may be fraudulent, or which customers may cancel a service. In these contexts, accurate prediction alone can help decision makers allocate resources more efficiently. When a model predicts risk accurately, it allows organizations to prioritize attention where it is most needed. For example, hospitals can identify patients who may require additional follow-up. Banks can flag suspicious transactions for further investigation. And companies can anticipate supply needs based on predicted demand. In these cases, the model is not necessarily explaining causal mechanisms. It is simply identifying patterns that help guide targeted actions and resource allocation. However, prediction alone is not always sufficient. There are important types of decisions that should never rely solely on associations. The first type involves policy interventions. When policymakers introduce a new program, regulation, or public health intervention, they are actively changing the system. A predictive model might identify correlations between variables, but it cannot guarantee that changing one factor will produce the desired outcome. Without causal evidence, policies may be ineffective or even produce unintended consequences. The second type involves medical treatments or clinical interventions. A machine learning model may predict that certain patients have better outcomes under specific conditions, but this does not necessarily mean that the treatment itself causes the improvement. Confounding factors such as baseline health or socioeconomic status may explain the association. For treatment decisions, causal evidence is essential to ensure that interventions truly benefit patients. The third type involves large-scale resource allocation. Governments and organizations often need to decide where to invest limited resources. If those decisions rely only on predictive associations, funds may be directed toward factors that are merely correlated with outcomes rather than driving them. Causal analysis helps identify which actions will actually produce change. The key message is simple: machine learning can greatly improve prediction and prioritization, helping decision makers act more efficiently. But when decisions involve changing systems, implementing interventions, or allocating major resources, causal inference becomes essential. At SMARTICON, we help institutions, researchers, and organizations combine predictive analytics and causal methods to support better decisions. Because understanding data is not only about predicting the future, it is also about knowing what actions truly make a difference.